Okay, we'll get started. So, hello and welcome to another session of Careers Beyond Academia, hosted by the Stem Cell Network and Medicine by Design. My name is Fiona Cunningham, and I'm the Director of Research and Training at the Stem Cell Network. This webinar will be recorded, and we are thrilled to be co-hosting this series with Medicine by Design. Our goal is to expose as many trainees as possible to different careers that are available after a degree in the life sciences and start to understand the qualifications and experiences necessary to secure that role. Stem Cell Network and Medicine by Design have teamed up to host this series, which has already highlighted a wide variety of careers available after a degree in the life sciences. You can see past Beyond Academia recordings on the Stem Cell Network's YouTube channel, and we have new sessions coming out monthly throughout the year. Stem Cell Network also offers other training events occurring monthly. Check out our websites and social media for the many other opportunities that Stem Cell Network and Medicine by Design offer throughout the year, including workshops, seminars, and symposiums. And don't forget to sign up for our newsletter and to be notified of upcoming opportunities. Links to sign up are provided on our websites. With that, I'd like to introduce our first speaker. And a big thank you to Danielle Spice and Kevin Robb for joining us today. So our first speaker is Dr. Danielle Spice. She earned her PhD from Western University, where she explored the role of hedgehog signaling in early neural specification. Dr. Spice changed fields in her postdoc, researching the role of metabolism in kidney development and mitochondrial disorders in childhood kidney disease. While in her postdoc, she jumped on an opportunity to shift away from basic science and into industry with her first industry position at a biotech company focused on creating gene-edited induced pluripotent stem cells for safer delivery of cell therapies. Recently, Danielle has moved to an early-stage biotech company that is currently in stealth mode, where she works with her team to take on gene editing and cell differentiation projects to develop novel cell therapies. So thank you for joining us, and the screen is yours to present, and we look forward to hearing what you have to say.
Amazing. All right, give me 2 seconds to get that up for us. All right, so thank you so much, Fiona, and for the Stem Cell Network for inviting me to talk to you guys today about my experience in the kind of early stage biotech sector. So my current title is as a lead scientist one. And to just get us going, like Fiona mentioned, my company is currently in stealth mode. So hopefully we'll be able to tell you, what my company is, what it's called, what we actually do somewhat soon in the future. But as of right now, my lips unfortunately are sealed and I can't tell you too much about, the exact field and the exact work that I do. But just know that I'm in an early stage biotech. So to take us through kind of my career timeline to date that Fiona kind of mentioned in my bio. So I got my PhD from Western University between the years of 2016 and 2022, and I just have my PhD. So I didn't get a master's degree. Instead, I transitioned from the master's into the PhD during those years. And then I transitioned into a postdoc role at Sick Kids Hospital, and I was only really there for just under a year. So there are a bunch of different reasons for why academia wasn't really serving me at the time, both personal as well as scientific. And when an opportunity presented itself where Pancella, this kind of later stage biotech startup, was looking for a scientist, I really jumped at the opportunity. And so I was with Pancella for about a year. And as we'll get into, sometimes in the biotech sector, there are dynamic timelines. And when companies get acquired by other companies, sometimes early stage biotechs become something else. And so Pancella actually no longer exists in Canada. And so I was actually, thankfully at the time, looking to transition into a more earlier stage biotech company. And that's where I landed today, in my current role today as a lead scientist one, that I got this position in May of this year. So what does my job kind of look like at a quick glance? So the typical background that someone's going to need in order to jump into this role is from two different perspectives. So you can either take my perspective of having a PhD with 2 additional years of industry experience, or you can have a master's degree with about 6 to 8 years of industry experience on top of that, as one of my colleagues does not have a PhD, but she is actually one level higher than me. And when she got into her first scientist role, she has a master's degree and extensive industry experience as well. The key with having a master's degree, if you don't have a PhD or a PhD with postdoc experience, is that you have to kind of convince your previous roles where you've had that 6 to 8 years of industry experience that you wanted to move away from being a tech and more towards the scientist role, and really wanting to actively look for opportunities where you can get training in experimental design as well as more scientific presentation. The potential salary range for scientist one roles are in Canada at least are anywhere from 90,000 to 120,000. That really depends on the company, what their funding looks like, but that's where you would want to kind of try to land. In a single sentence, what does my job title actually require? So I genetically engineer induced pluripotent stem cells for the development of differentiated cell therapy products. And so this kind of highlights a lot of the key skills that I need in my day-to-day. So iPSC cell culture is kind of number one, and then CRISPR gene editing is kind of number two, where because my company is so small, there's myself, one other scientist, and our supervisor. I'm in charge of our gene editing workflow and building up our gene editing program for the whole company as it stands right now. And then my colleague is in charge of building up our cell differentiation programs. So it's a big responsibility. And so we have to have, quite extensive experience in these key skills. Given the field that we are in and the requirements for our differentiation program, I also need to have key skills in flow cytometry, and then in kind of more soft skills in giving scientific presentations, as well as in data management. The data management piece being really, really important when you're moving into industry, because all of your projects you're working on as a team, and we want to make sure that from between team members and between managing up as well, in terms of me being able to tell my supervisor or investors what we're doing, we need to make sure we have really good record keeping, as well as kind of like batch records and knowing what we've done in a very granular way. So, thinking about other careers that I had considered, I honestly never saw myself when I was in grad school as going into industry. I 100% wanted to be a principal investigator. That was my main goal in life. And unfortunately, perhaps, but I think fortunately, the academic system was no longer serving me. And the pathway to becoming a principal investigator became, in my opinion, quite cloudy and something I was no longer interested in pursuing. And so that was why, even though I did think about also potentially going into being a teaching professor, I'm really glad that I chose the industry route. A day in my life in terms of typical activities, you can see maybe from my blurred background that I have some days where I'm off-site having computer days, as well as having some really busy lab days as well. And this is really dynamic. It changes from week to week, from month to month, depending on what where we are in our different projects. So on a busy lab day, this can be anything from passaging or feeding iPSCs, could be electroporating or transfecting cells with lipofectamine, as well as setting up and maintaining some of our differentiation experiments. That can also include harvesting cells for flow cytometry, cryopreservation, as well as just maintaining the lab space. Some of my offsite computer days, though, are a lot more about critical thinking, data analysis, and communication of what we've been up to. So that includes technical and operations meetings, again, data analysis, and prepping for our experiments, ordering materials and creating the data sheets that we're going to need in order to, as I mentioned, have really good data management. So there are some things that I really, really like about my job. And then there are some things that are also that pose some more challenges. So why I think my role is really, really important, as I've written here, is I am developing cutting edge products that I genuinely believe have the potential to help a lot of people. And I would say that this is, kind of an important piece about if you're someone like me who, loves the science and wants to have impact, making sure that you align your goals as well as your values with the values of the industry company that you're trying to get involved in. And, my values and the values of my current company are very aligned, and that's really important to me. Some reasons why I enjoy my role. I have a ton of opportunity to showcase my scientific creativity. So because my team is so small, we have to have really innovative ways. And because it's so cutting edge, we need to, collaborate together, read the literature, and come up with potentially, brand new ways for us to design experiments or, to design gene edits in order to create the products that we're trying to make. I also like that my technical skills from my training are constantly being used. I've spent like 10 years of my life training on how to do these things, and I like that I get to actually utilize those things. There's also new opportunities to learn technical and analytical skills. Personally for me, I don't want to be in a role that I'm not constantly learning and constantly being challenged. And in, a really small startup, you have those opportunities to learn things from your colleagues, as well as, working together to, build out your programs that are technical skills that maybe you don't currently have. And having this small cohesive team is really important to me. But of course, there are challenges. So I would say the number one challenge that I've seen so far is that although I love having a really small team, it's kind of a double-edged sword where, I have expertise in gene editing, my colleague has expertise in differentiation programs, but we don't necessarily have expertise in everything that could come up. And if you had a larger team, you might be able to utilize the expertise of other people. But because our team is really only two to three, we really aren't considered an expert in all technical or scientific areas. And that can sometimes pose a big challenge. Additionally, our timelines are quite short in industry in comparison to academia. And what's challenging about this is with such a small team, only so many experiments can be done at one time. And we have to be really good self-advocates to kind of the board as well as our management team to advocate for ourselves and what is reasonable within the timelines that are being asked of us. Something that is not a direct role of my job, but is kind of just a challenge of the biotech startup space in general, is that raising money is really hard. And especially as an earlier kind of discovery stage company like mine, we have to work with very small budgets in order to create the data that we'll need in order to be attractive to further investors. And hopefully once we get those further investors, then we'll be able to, open a lot more doors and get a lot more done quickly. And something that I'm sure another challenge that you in academia are probably very familiar with, but unfortunately in some startup spaces continues, is that I often do have to work on the weekends when the experiments require it. And because again, my team is so small, there's only 2 people and we kind of need to so I basically work every third or every other weekend within reason. Some future career trajectory opportunities for this role that I have seen for myself. Of course, working and progressing through the different scientist levels is kind of my first step. And then hopefully becoming a manager or director of a larger scientific team as the company gets larger over time. And then finally, if I come up with something that's a really good idea or like a consulting firm, potentially starting a new biotech on my own. That would be, many, many years in the future. So kind of maybe the most important part of this presentation of what is my advice for you as my listeners to actually transition out of academia into the startup space. So the first thing is to become a technical expert in skills that are really attractive to industry. So flow cytometry is one of the number one things that I've seen that people really want in this kind of startup space, at least in the Toronto area, as well as iPSC cell culture and bioinformatics. So as an example, I didn't necessarily have all of these required attractive skills after I was done my PhD. As I mentioned, I wasn't, actively thinking about transitioning into industry. And I was really thankful that even though I had a short time at SickKids during my postdoc, I was able to learn a lot of these attractive skills there. Second is to get comfortable giving scientific presentations. You will absolutely be required to do a scientific presentation during the interview process. And I probably average giving 2 half-hour to an hour presentations a month in my current role, which isn't going to be true for all teams, but is true for my current role. And kind of what I said as my last point, as the absolute most important thing that I want you guys to take from my advice is become someone people genuinely like to be around. And hopefully, you know, that is to everybody who I'm speaking with, but ask yourself these questions. Are you easy to talk to? Are you easy to get along with? And maybe most important, do you take feedback well from peers and superiors? With such small teams in the biotech space, you can't be the jerk in the office. That's just not going to be okay. So being someone who is genuine, who's honest, who has integrity, and who is just fun to be around is going to get you hired over someone who in the interview process maybe seems like they're a little standoffish, or that they may be a difficult person to work every day with in kind of tight quarters. And as my last slide, I just want to mention that industry is really awesome. Like I said, you get to use your skills that you've spent all these years mastering. You get paid pretty well, and you get benefits as well as potentially get RRSP contributions, which as an academic, I didn't even know what that was until I started in industry. You get to perform really cool cutting edge research, but you don't need to worry about the pressure to publish. Yes, there are many different other pressures, but you know, the dreaded p-value isn't going to, you know, make or break your career. You also get to prioritize work-life balance, and despite the fact that yes, you have to work weekend or sometimes overtime hours, these hours are tracked and they're given back to you. So you get to take that time back as, you know, lieu time. And finally, you know, I genuinely feel like work in industry is so impactful because you're that next step between going from academia into an actual patient, especially if you work at a therapeutic company. And so impact is huge in industry. So I encourage everybody to consider the biotech sector. And thanks so much.
Great, thank you. That was great. I think I learned a couple of great tips in your presentation. I do note that there's a few questions that have come in the Q&A. We're going to go through with the next speaker, and then we'll come back to all the questions at the end of the session. So if you think of anything along the way, please feel free to pop it in. So Danielle, thank you. That was really insightful. So our second speaker is Dr. Kevin Robb, and he is a scientist in research and development at STEMCELL Technologies in Vancouver, Canada. In this role, Kevin applies his 8 years of research experience on mesenchymal stromal cells to develop products and workflows that support research in the field. Kevin completed a PhD in biomedical engineering at the University of Toronto and University Health Network, where his work led to multiple publications and patent applications. He also writes about professional development and cell therapies as a blogger for the Centre for Commercialization of Regenerative Medicine, or CCRM, in Toronto. So, Kevin, thank you for joining us today, and I'll give the Zoom over to you.
Okay, great. Thanks so much, Fiona. You can see my full screen, okay?
Yeah, you're all set. You can
Okay.
we can see your side slides if you wanted to share a little more full, but
Oh, okay. Let me try that. Is that better?
it's the same, but it works.
Okay. Okay, thanks so much to the Stem Cell Network and Medicine by Design for having me here today. I'm really excited to be here. My name is Kevin. My pronouns are he, him. And currently I am a scientist at STEMCELL Technologies. And I'll run through these credentials in my following slide. So in terms of my career timeline, so I completed an undergrad in physiology at McGill University and became interested in research quite early on. So working in labs at Queen's University and McGill. And from there, I decided I wanted to pursue grad studies, and I completed a master's in biomedical engineering at Western under the supervision of Oh, okay, I'm getting a comment, need to change screen. Let me try this again. Okay, does that look better?
Perfect, thanks.
Okay. Okay, so I completed a master's in biomedical engineering, working on a tissue engineering project. I then transitioned over to a PhD program in biomedical engineering at the University of Toronto, working in Sowmya Viswanathan's lab at University Health Network, and co-supervised by Dr. Rajiv Gandhi. And here I was working on improving mesenchymal stromal cell therapies for treatment of knee osteoarthritis. I also want to give a quick shout out here to the Stem Cell Network, which I was involved with over several years during my PhD. I'm sure I'm preaching to the choir here for those of you on this call, but the Stem Cell Network provides a lot of amazing programming and professional development opportunities that were really foundational to my training during my PhD. And so some context here before I talk about what came next after my PhD. So I started, similar to Danielle, I started my PhD intending to continue on an academic route, pursue a postdoc, and eventually open up my own research lab. But partway through, the pandemic hit, I became a little bit lost, and I decided that that path was not quite right for me. And so what followed, I would say, so by the end of my PhD, I was struggling with a little bit of burnout, and I was really uncertain about my next steps. And so I took a little bit of time off after my PhD. I defended in June of 2023, took some time to recharge, and then I engaged in what I'm calling here a professional soul searching process. So during this time, I returned to the lab that I did my PhD in, working part-time as a postdoc and also as a scientific writer, preparing manuscripts for myself and assisting others in the lab. And because this was part-time, this allowed me time and energy really to do the research that I needed to do in order to figure out my next steps. So during this period, I was reaching out to my network, scheduling informational interviews to learn about different types of roles and what potential next steps could be for me. I also continued blogging for CCRM, which is something I had started several years back, but picked up a little bit during this time. And so one of the things I was trying to figure out is whether I wanted or needed more training in the form of a postdoc. So I used this as an opportunity to draw on expertise of professionals in the regenerative medicine space. And I interviewed them on this topic and then ended up writing a little blog post on it. So this was helpful for me in trying to figure out my next steps. And then during this period as well, I was actively applying for jobs in different types of roles, interviewing for those positions. And through that process, I was also able to learn more about different opportunities and the positions that were out there. And so through this soul searching process, I was really excited to receive an offer from STEMCELL Technologies, I think towards the end of November 2023. And I started in my current position as a scientist at STEMCELL earlier this year. So I've been in that role for just under a year now. So I am based in Vancouver, British Columbia, which is where the STEMCELL headquarters are located. And for those of you who don't know, STEMCELL is Canada's largest biotechnology company. The company makes products, cell separation technologies, instruments, and other products that are intended to accelerate biomedical and clinical research. Okay, so in terms of typical background for this type of role, So as Danielle said, often this is someone with a PhD or several years of experience in the life sciences. Potential salary range, so this is taken from previous job postings for scientist roles at STEMCELL. What I do in a sentence, so I'm working in the research and development department at STEMCELL on the mesenchymal stromal cell team. And so in terms of what I do, I would say I design, develop, and support products and tools that accelerate mesenchymal stromal cell research. Key skills include critical thinking, experimental design, and troubleshooting. Cell culture is really a staple sort of technique that a lot of folks in R&D are doing almost daily. And then communication and teamwork are a big one as well. So being able to work with others and also communicate research findings. In terms of other career paths I considered, so I mentioned principal investigator was one. And partway through my PhD, I decided to take a different path. And then during that soul searching period that I'm calling it, I was applying not only to scientist type positions, but also scientific writing roles and roles as an academic journal editor. And so I think really the common denominator for me here was that I wanted to continue in science and actively contribute to research, either directly or through more of this dissemination lens. Typical activities for my role include running experiments using a variety of different lab techniques, experimental planning and really taking ownership over projects and figuring out how you can drive the project and where it needs to go, and then planning experiments accordingly. Analyzing data and interpreting the data that I've generated, summarizing and presenting the research findings in small group meetings or in departmental meetings. The role also involves meeting with project collaborators and members of the sales and marketing teams in order to get their input on projects, but also to provide expertise and input on other projects as well. So why my role is important. Researchers rely on products that are generated in research and development at STEMCELL in order to conduct work that advances fundamental biology research, biomedical research, and clinical research as well. And so I'll give an example here, hopefully to help you conceptualize this a bit further. So this is a press release that I've taken off of STEMCELL's website. And it covers an Easy Step kit that was produced in R&D at STEMCELL. And earlier this year, it received an FDA approval as a novel in vitro diagnostic tool to be used in diagnosing patients with multiple myeloma, which is a cancer of the B cells. And so essentially this kit allows for isolation of B cells for downstream genetic characterization, and it greatly improves the sensitivity for this type of diagnosis in cancer. And I've bolded here that the product is the result of more than 230 bone marrow aspirates from multiple myeloma patients that were analyzed. And a lot of that work was done in R&D at STEMCELL. So hopefully this gives you a little bit of a flavor for the type of work that we do here. So why I enjoy my role, it requires a broad understanding of my research field and to keep on top of current trends in the field. What are the key research questions? What are the pain points that researchers in the field are struggling with? And then how can you design a tool or a product in order to address those pain points and help researchers address their burning questions? And so, as you can imagine, this is challenging. It requires critical thinking, creativity, innovation, and strategy. And these are all reasons why I enjoy the role. And there's opportunity for real-world impact. Challenges, I'll say, include that there is volatility in the biotech market. So You've likely heard that a lot of biotechs have been experiencing layoffs, particularly in the past couple of years. And so this does make things challenging. In terms of future career trajectory, so there's opportunity similar to what Danielle said to sort of move up the scientist ladder and become sort of more of a team manager. And there's also opportunities to move into other departments, so sales, marketing, product specialists, for example, depending on an individual's strengths, interests, and the needs of the company. So in terms of career planning advice, I'll start by saying it feels a little bit strange for me to be giving advice to this audience, given that I'm so fresh out of my PhD. So the advice I'll give is really focused on that transition period immediately following my PhD. And then I'll also reframe a bit of advice that was helpful for me during that period. So my first bullet point here relates to that transition period. So during that time after my PhD, when I was trying to figure out my next steps, that was a period of a lot of anxiety and uncertainty for me. I wasn't sure where I would end up living or what I would end up doing. And so my advice here is to be kind and be patient with yourself. Take the time that you need to reflect and figure out what's right for you in your next steps of your career. And you don't necessarily need to take the first opportunity that comes your way if it isn't going to be a right fit. Just be patient and keep at this process if you can. And so the second bullet point is advice from Kate Murray, the president and CEO of the Stem Cell Network. And she said, in a session she was giving on elevator pitches to know your why. And so her intention here was to convey that when you're introducing yourself in the form of an elevator pitch, to not just explain what you do, but also why you do it. So provide this emotional piece, and that's something that really is going to stick in people's memories. And so if we apply this advice to the context of career planning, again, I think it's important to reflect on your interests and your values when considering potential career paths. And so ask yourself, what is your why? Why are you doing the things that you want to do? This will also be helpful when you're interviewing, when someone asks, why are you interested in this role? And then we can also flip this piece of advice around a little bit. One of the questions that I would frequently get in interviews from recruiters and hiring managers was, what do you know about our company? And often here, the question asker is not asking you, what does the company do? So in Stem Cell's case, for example, I would say the company makes high quality products for life sciences researchers. But they also want to know why the company does it. And so in Stem Cell's case, this would be to leverage the expertise that we have at Stem Cell to help other researchers advance knowledge, enable discoveries, and ultimately to cure cancer and other diseases. So with that, I think I'll leave it there and happy to take more questions in the Q&A.
Thank you. So for Dr. Danielle Spice and Dr. Kevin Robb, on behalf of the Stem Cell Network and Medicine by Design, I'd like to thank both Danielle and Kevin for fantastic talks.